Hey, well, I'm here today with Dr. Pouria Moradi, and Dr. Moradi is a specialist plastic surgeon, and he works from Park Clinic here in Sydney. And today we're going to have a chat about what he does and also about the Motiva breast implants. So thank you so much for joining us today.
Pleasure being here. Pleasure having you.
Lovely. So tell us what surgeries do you do? What's your specialty? What do you love?
What do I love? Not working. No. So I guess what I do in the public hospital, I do microsurgery for face and breast reconstruction, such as head neck reconstruction and breast reconstruction after mastectomy. And I use the same skill set in the private, where I mainly do cosmetic operations of the breast and the face. So they're my two subspecialty interests, I guess.
Okay. And I know that you do use the Motiva breast implants.
Yep.
So can you tell us what is it that you love about the Motiva implants?
I guess I've always been an anatomical implant guy for lots of reasons, but the major reason I like the anatomical implants was the gel. And the gel was form stable, it held its shape, and you knew, you just trusted it. You put it into a particular pocket and it created its shape. Now, the problem I had with the old saline implants, I've got one just...
The drawer full of implants here, it's like, whoa.
Drawer full of implants is... Got one somewhere, should have got it all ready. The problem with the old round implants is that you didn't trust them to hold their shape. Okay, so if you needed any support for the lower pole, not necessarily tuberous breast, but something that you needed that lower pole expansion, whilst keeping the upper pole shape, I just didn't trust the gel, the cohesive one gel of the other round implants that are on the market, because I didn't trust that they would hold the shape. If you're putting an implant in, if a patient's got perfect breasts to start with and you're just trying to make them bigger, it probably doesn't make as much difference whether you go teardrop, round, or what sort of cohesiveness you use, because they've got good shape anyway, you're just trying to make it bigger. And that's the American model, where they just put saline implants in, because obviously for some people, saline implants, not that I'd ever use them, are good because they just do the job of making the breast larger. However, if you need shape, that's what teardrop implants have traditionally had. And what I like about the Motiva is it's just a good gel. Okay, I like the gel because it's less rippling and it's a bit, I don't know if the firm is the right word, but it's got better elastic properties. So I can trust that when I'm trying to do a more difficult type of breast augmentation, that I can trust the gel will hold its shape and not ripple and not deflate, but not lose its support shape.
So usually if someone gets that's it, isn't it? So if someone gets the rippling, that's from it's actually from the implant.
Well, it is, but I say to all patients, all implants ripple. Over time they will ripple. In fact, breasts ripple. If you bend over, if a woman breasts open, the breasts ripple. So rippling is like a normal phenomenon of any dynamic thing. However, you want an implant that ripples less, and that's why traditionally the form stable, whether Allergan or Mentor implants, the cohesive 3 gel that they have rippled less because they're a bit firmer, and they're a bit but their round equivalents are softer and they're less filled. So what I like about the Motiva is it's fully filled implant, so you trust that it's going to keep that shape. Now, will it keep its shape with different body temperatures? I don't think anybody knows that, so it would be naive to think that one implant won't ripple at all. But on table, one doesn't ripple because of those mentioned properties and the other does. Under the muscle, different body temperatures may affect the viscosity or elasticity, but that's not important. It's what it does on table.
Yeah, of course. So I've got a couple of questions, if you don't mind.
Fire away.
So can you tell us, how does the Motiva Silk Nano Surface help to reduce complications that can be associated with breast implants?
I don't think it can. No, so I guess, what are complications? I mean, complications such as bleeding, malposition and all that, I just think that's surgical technique, so you can't really blame an implant. One of the things I do like about the Motiva is that it is classified as a smooth implant, and in this day and age of ALCL, you have to be aware that is a risk. Now, Mentor implants are fantastic. They've got very low ALCL rates compared to the others, and I guess with Motiva we'll find out soon, but the classification of being smooth does help when you say to the patient, well, that risk is probably less than if you had the macro textured implants of some of the other companies.
Yeah.
So how does it reduce the risk? Well, it hopefully reduces ALCL, who knows, but at the moment it looks like it possibly can. The fact that the ergo does act like a teardrop in a way, then you kind of get rid of that animation, the rotation as a risk.
Right.
A lot of patients are worried about rotation. And it's a funny risk because the risk is still pretty low with teardrop implants, but it's a risk nonetheless that the patient has to deal with. Although the risks are in less than 5%, it's still something that patients worry about.
Yeah. So why do you what advice would you give to a patient who's looking to find a surgeon to have implant surgery with? Like, what should they be aware of? Like,
I guess the most important thing is aware of their goals.
Yeah.
Like, what are they trying to achieve? Because once they know what they want to achieve, then it's easier to relay that onto their surgeon so that he or she can guide them along that path. Because if a patient is a size 12 or 14 and they bring an Insta photo of a size 6 fitness model, that's just not going to happen because the goals are just totally separate. Others come in and go, well, I want a natural result. They go, okay, well, show me the Insta photos that you like, and they're all high profile fake look. So it's like, understand what the goals you want. Then I'd say to them, go on as many surgeons' websites and look at their galleries, because by APRA guidelines, the gallery photos have to be the same. And it's always good looking at naked before and afters because there's no bra trickery, there's no selfie trickery. So bringing in photos of patients in swimwear or fitness outfits, photos taken like that, everybody looks good from that angle. That's why people take that angle from that view. But getting other patients that look like you, have had an implant similar to you, and that's a good starting point. Because if you look good naked, you look good in a bra.
Yeah. All right. So why do you reckon? Why do you think it's important people know what implants they have? Because people don't really know what implants they're having put in. Like I've had patients on our forum and we've said, well, what sort of implants have you got? And they don't even know the size, let alone the brand or
There's a lot of that, and especially when you come for revision operations, you're kind of shocked to see how little people know of what implant they have in their body. Even though they get the sticker and they should have all that information. I guess it's up to the surgeon a lot of the way, to the surgeon guiding the patient on their goals. So patient education is important because now patients are asking for Motiva implants because of forums like yourselves. People discuss and chat. When patients come in, my discussion is pretty straightforward. Whether you want teardrop or round, if they automatically want round, then that's easy. I'm using the Motiva. The decision is whether I use the ergo or the progressive gel, depending on the look that they're after. Now, if they do want teardrop, then the conversation goes, okay, here's teardrop, here are all the risks. As with anything, there's 2 extra risks with the teardrop that you don't get with the ergo.
What are they?
Which is the rotation and potentially, because of the texturing, potentially ALCL. And then when you put it to them, and then you go, okay, all else being equal with the breast platform that you have, I think you'll get as good a result with a ergo Motiva than a teardrop. The patients go, okay, well, I get that. If you think I can still get that teardrop look, then I'd say, look, get the ergo, because I think you can. Now, if a patient came in with a really tight lower pole, tuberous breasts, we're not having a conversation about the Motiva ergo, because I still think you need that cohesive, you need that expansion in that lower pole that you'd get more with a certain type of teardrop implant.
Right. So it's going to be, and I think they're bringing them out, so it's going to, your conversation with them is going to be depending on what they need.
Correct. And I think nowadays with social media and with forums like yours, patients are so educated. Like, they come in, they go, I want moderate plus, this, blah, blah, blah. And then a lot of the time they're kind of nearly right. You just have to guide them one way or another and go, you know what, that's not going to work. They sometimes don't understand the different profiling. What is a profile? They think projection and profile is how high it goes rather than how far out it goes. So once you let them know about that, then they...
So profile is projection?
So, same thing. Profile and projection. Allegheny and Mentor use different terminology, profile and projection, but they both mean the same thing.
All right, cool.
So the analogy I say to patients is you're trying to build a house, okay? And when you build a house, you have a parcel of land. If you've got a 200 parcel of land, you can't put a 400 house. You look ridiculous. But if you've got a 400 parcel of land, if you went and put a little shitty 200 house, it looks silly as well. You have a big gap. So you build the breast on your chest platform, your parcel of land. Okay. Then if you want to go bigger, once you've got the width and the height right, then you can work on projection. So if you've got a 200 parcel of land, you want a 400 square house, 2 stories or 3 stories. Okay. So 1 story is a moderate, 2 stories moderate plus, 3 stories a high profile, or the minis, the demis.
That's a really good way to explain it.
That helps them.
That helped me.
So I go, you know what? It sounds like you need a 3-story house. For your width and your height, you want high profile or the full implant. So that's a 3-story house.
Yeah. All right. I've got a couple of other questions. So what type of patients do you think are best suited for a breast lift augment?
I think, well, it's kind of reasonably straightforward. The ones that, so there's different styles of breast lift and implant. If your nipple's below your crease, easy. You need a breast lift. You need a breast lift. The decision to have an implant.
When you say crease, like where?
So if you've got your IMF crease here, and if your nipple is below it, then you definitely need a lift. So there's the ones that definitely need lift. There's no grey area. It's those ones that are borderline that becomes a difficult decision, and the ones that are difficult when the nipple is above the crease. However, if you've got glandulatosis, where most of the breast is below the crease, so although the nipple is above the crease, if most of the breast is hanging lower than the crease, you need a lift on those ones as well, because you're trying to reshape the breast tissue. So you're trying to create that perfect breast with the lift, and then you're trying to augment that perfect shape with an implant.
Would you pick a different, like, would age come into this of the woman having the implants as to which? No, it doesn't. Okay.
Not at all. I mean, age becomes an issue at previous weight loss or pregnancy if you're trying to get away with the scarless breast lift. What is a scarless breast lift? That's when you're using an implant to lift the breast up and you're only having a scar in the crease. But in those particular situations, the nipple's usually in a good position. You're just trying to fill out that lower pole with an implant, and that naturally lifts them up.
Okay. So when you see someone that's just got a little scar on the bottom, so they've just had
on the bottom of the
so that's a scarless breast. So it's quite simple to do.
Well, it's like a breast augmentation. A scarless breast lift is a breast augmentation through a crease, but you're using generally a teardrop implant to try to kick out that lower pole.
Okay. All right. Awesome. I've just got a couple other little questions. So what technique do you use with the Motiva ergonomics implants to help achieve a soft, natural look?
The soft, natural look, it's all back to the patient. So if a patient has big breasts to start with, or breasts to start with, seen above, they're always going to get a soft result because they've got so much soft tissue coverage. They've got breast and subcutaneous fat. They're always going to feel soft. Okay. Now, if a patient has no breast tissue and skin only, they're going to feel a bit firmer, no matter what implant you use. Now, what I like about the ergos is they are soft. So in those patients that have limited breast tissue and limited subcutaneous fat, it's a softer implant, so they're going to get a softer result. But I say to patients, it all comes down to percentages. Let's make the numbers up. If you've got a 300-gram breast and you put a 300-gram implant in, that means 50% of your breast is breast and 50% is implant. So you're going to have a more soft tissue coverage. Then if you've got a blank canvas, we've got no breast tissue, and you've got a 50-gram breast, and then you put a 300-gram implant in. So 85% of your breast now is implant. Of course you're going to feel the implant more. And conversely, if you've got a D breast, which is like an 800-gram breast, and they're the tougher ones because patients goes, I want that big fake look, but you've got that much breast tissue and you put a 400-gram implant in, only 1/3 of your breast is now implant, so it's hard to take the nice fake shape when you've got so much of your own breast tissue. So they're going to always feel soft and natural, whereas the ones with a totally empty...
that makes sense. Very
interesting.
Yeah. All right, and one last one. So if you can tell us just one of the features that you like the most about the Motiva?
I might name a few.
All right, go on, even better.
There's a few. One, it just feels nice. So when you give it to a patient, you go, okay, these are your choices.
Yeah.
Everybody chooses the Motiva just on tactile sensation because the gel feels good and the texturing is good.
Yeah, they do feel good.
The thing I also like, which is very minimal but I really like, they come in 0.25 millimeter base width ranges.
Mm-hmm.
So all the other traditional ones, they go from 12 centimeters to 12.5 to 13.
Mm-hmm.
Okay.
Mm-hmm.
What I like about the Motiva is they go 12, 12.25, 12.5, 12.7. You know, so the increment is by
and you mean this part here?
I mean the width, the width of it, the width of the implant. Because for me, the most important thing is the width.
Yeah.
So you get the width right, i.e. the parcel of land.
Yeah.
And then you work on projection.
Okay.
So I like that it comes in 0.25s as well.
Okay, yeah, that's pretty precise.
Yeah. Mm. It just gives you more options.
Yeah.
For the asymmetrical cases.
Yeah. Something I was going to ask you last question. What was it? Oh yeah. So if someone's wanting to have a breast augmentation, why should they come and talk to you?
Why should they come to me?
Actually, we'll just watch this video.
Yeah. I guess back to you asked previously. You know, what do they need to do to pick this? Yeah. First, you need to know your own goals.
Yeah.
Then you need to go on surgeons' websites and see the galleries, I think, and then go see. I'd say 2 to 3 surgeons.
Yeah. And the qualifications.
Yeah, I think the qualification. Well, you're hopefully going to see the AMC accredited surgeon, such as a plastic surgeon, to do your operation. And once you've narrowed it down, then I think it just becomes a feeling that you have with your surgeon, because hopefully you've picked somebody who you trust their work. So tick. Then you've looked at the qualifications. They're part of ASP, they're part of the plastic surgeon tick. So the next is, do they listen to you? Do they get what you're trying to do? Get what they're trying to do? If you want to buy a car, you go see 2 or 3 dealers anyway. Anything you do, you see a couple of dealers. So it's a similar principle. Try to see as many people as you can. It's kind of impractical having to pay the consult fee every time. I wouldn't recommend seeing 5 or 6 because you're going to get 5 or 6 different opinions, and that will really drive you nuts.
Yeah.
So I think two, maybe 3. I wouldn't go more than 3. And then see which ones. Yeah,
but then you'll kind of know who you're more comfortable with. You know, that everyone's probably going to have a different opinion as to implants as well, and you'll feel what's right for you. You just got to go with it.
The thing is, when everything goes well, it's all fun and games. It's all good.
Yeah.
You just want someone there if things don't go well, that they've got your back and they're not going to throw you out. Yeah. And that's the key. Yeah. And with anything, back to buying a car. Totally. If the car's not working, you'd want to go to someone that goes, hey, you know what? Sorry. Yeah. We'll try to fix it.
Yeah, totally. One of the things I like about these implants, which if you can tell me what you think of them, I like the fact that because ladies all the time they don't know what implants they've got, what they've used, whereas with these you actually know forever. Yeah. You got the chip. Yeah. So tell us about that. So each of them have got a number, or
they've got the number, and then you just scan them. And I've tried to scan, and it works. It's pretty cool.
Yeah.
I think that's important. I've had patients say, "Can you remove the chip?" Which I said no to.
Yeah.
So I don't know how to remove the chip.
Yeah.
I guess that is a very important factor as well. The thing is, what I like that Motiva has done. The implant market was in such a stagnant state, and there was very little innovation. They try to do the light implants and the polyurethanes, and I don't think they work for so many different reasons. But it was good that these guys, or girls, I don't know who designed it, try to think differently. And the texturing's important. I love the texturing, but if you said what do I love most about it, I'd like the gel.
Yeah.
I really like the gel of it.
Everyone says that. Because I was asking before, like implants haven't changed in 20, 30 years?
Yeah, there's been and you know what? I think what this will do.
For a next generation implant.
I think what this will do will get the other companies to proverbially pull their fingers out and try to innovate and try to do well.
Yeah. Just it's all about continuous improvement. Hey.
Yeah, correct.
With everything we do.
Yeah.
Well, thank you so much for taking the time to join us today. Yeah.
Thank you.
So, ladies, if you're looking at having breast implant surgery and you're after Motiva implants and you're after a great surgeon, don't look past Dr. Moradi, and you can find him here at the Park Clinic. You can find him. You can either Google him or you can check out our website as well. So, thank you so much.
Thank you.